evening, magandang gabi, maayong gabi. I am Julian Estabalos of Group 3, and for today's video, we're gonna talk about hepatitis. So together with me are my groupmates, Ronjamin, Craig, and Franz. So syempre, as the bida-bida of the group, I will talk about hepatitis A. So what is the causative agent of hepatitis A? Hepatitis A virus or HIV is a single-stranded RNA virus. Infection with HIV induces lifelong immunity. What is its reservoir? It's the gastrointestinal tract of humans. And for its taxonomic group, it's within the family of Picornaviridae. Hepatitis A virus closely resembles members of the genus Enterovirus. And for hepatitis B, let's go hear it from our baby boy, Ranjan.
Good day, everyone. My name is Ronjamin and I'm gonna be talking about hepatitis B. So, a hepatitis B is a vaccine-preventable liver infection caused by what we call this hepatitis B virus or HBV. So, hepatitis B is spread when blood, semen, or other bodily fluids from a person infected with the virus enters to the body of someone who is not infected. The taxonomic group of the hepatitis B is classified in the genus Orthohepatnavirus, which contains 11 other species, and the genus is classified as the part of the Hepatnaviridae family. And the signs and symptoms of the hepatitis B range from mild to severe. They usually appear about 1 to 4 months after you've been infected. Although you could see them as early as 2 weeks post-infection, some people, usually young children, may not have any symptoms. So the mode of transmission of the HBV is the virus is passed from person to person through blood, semen, or other body fluids, as I said before, and it does not spread by sneezing or coughing. So the common ways that the hepatitis B virus can spread are sexual contact, sharing of needles, accidental needle stick, and mother to child. So pregnant women infected with hepatitis B can pass the virus to their babies during childbirth. However, the newborn can be vaccinated to avoid getting infected in almost all cases. So the prevention for hepatitis B is that it is typically given as 3 or 4 injections over 6 months. And other ways to reduce your risk for getting a hepatitis B virus includes that you must know your HBV status of your sexual partner, and use a new latex or polyurethane condom every time you have sexual intercourse, and be cautious about body piercing and tattooing, and lastly, ask about the hepatitis B vaccine before you go to travel. And lastly, the treatment is that most people diagnosed with chronic hepatitis B infection need treatment for the rest of their life. That is the saddest part. And treatment helps reduce the risk of liver disease and prevent you from passing the infections to others. So treatment for chronic hepatitis B may include antiviral medication, interferon injection, and liver transplant. So for the hepatitis C, this will be discussed by Ate Franz Camino. And thank you.
Alright, so again, good afternoon. My name is Franz Camino, and I'm going to be discussing hepatitis C. So hepatitis C is an infectious disease of the liver, and the causative agent of which is known as hepatitis C virus or HCV. As per taxonomic group, hepatitis C virus belongs to genus Hepacvirus and a member of family Flaviviridae. Let's go now with hepatitis D, which will be discussed by Craig.
Thank you for that, Ate Fran. Actually, the hepatitis D virus is the least common type of hepatitis, but it is the most severe type of hepatitis because, again, it follows the hepatitis B. So there are 2 types of hepatitis D infections. We have our co-infection and superinfection. Ang co-infection, it happens when you both have hepatitis B and hepatitis D at the same time. While superinfection is you already had hepatitis B and then you are infected by the hepatitis B virus afterward. So once again, this is Craig and Twitter natin.
And this is Franz Jeremy Gamino.
And this is Ronjamin K. Hatches.
And I am Juliana Estabalos, and that's it for today's video. Bye!